Welcome back to the OHSU Effect Inside Health and Science. It's all too often that we hear about young athletes, high school, college age, suddenly dying on the field or court. It happened just this week to an Oregon State football player who was playing basketball at the school's rec center. Usually this is due to a heart condition. Dr. Seshadri Balaji is a professor of pediatric cardiology at OHSU Dornbecker Children's Hospital who specializes in the treatment of complex heart problems. He is a frequently cited expert on the cause and prevention of sudden cardiac death among teen athletes, and he joins me now. Good morning.
Morning.
What is sudden cardiac death, and how do you know when you're at risk?
Sudden cardiac death is a condition where your heart suddenly stops and you fall down dead. Most often what happens is that your heart goes into a rhythm called ventricular fibrillation, where it is beating so fast and so chaotically that it's effectively not pumping blood. It's not pumping blood to the body, it's not pumping blood to itself, and so as a result of it, the person dies.
Wow.
So how do you know when you're at risk? It's hard to know when you're at risk. There isn't a perfect test yet that can identify all people who are at risk of this. There are a variety of conditions that all lead to this end effect. It's not like it is one condition, and as a result of this one condition, you're at risk of death. It's a whole list of conditions. The most common condition that causes sudden cardiac death in young people, especially during sports, is a condition called hypertrophic cardiomyopathy. Cardiomyopathy means there is a heart muscle disease. So cardio is heart, myo is muscle, pathy is disease. And hypertrophic means that the heart is too thick. So these patients have an inborn underlying abnormality of the heart muscle. It is usually hereditary, genetic, and they acquire this condition from their genes, and they make abnormal heart muscle. And in response to that, their heart muscle gets very thick. If they have this very abnormal thickening of the heart muscle, then their risk of their heart going into this very chaotic heart rhythm, which I mentioned called ventricular fibrillation, which can lead to a heart sudden death.
High schools require sports physicals every 2 years. So are doctors able to catch most heart problems this way?
Not really. Currently the requirement is that every 2 years the athlete should get a history and physical. The most important part of this is the history. Now, the history is only as good as the person who is giving the history, and most high school students don't know their history. So one of the most important things is to know your family history and know whether there are other individuals in older generations or other relatives who have had similar conditions. And this is required every 2 years, and currently there is actually data that shows that the current screening requirements are not very good at catching people at risk of sudden cardiac death.
So you mentioned family history, and you say that's really important here. Why?
Well, there's a lot of genetic information in your family history. If you know that in your particular family that there is diabetes or there is heart attacks or there is hypertension and so on, that tells you something about the genes that you're carrying from your genetic pool that you came from. One of the things that families can do, for instance, is if they ever hear that an aunt or an uncle or a cousin or somebody dropped down dead while playing sports or even without playing sports, then they need to take it very seriously. They have to consider whether this particular condition, these particular conditions that run in families are present in their family, and therefore those children probably need to be brought to the front of the line and need to be screened very, very closely and looked at very carefully.
What about heart screenings? What does that entail, and is that part of a sports physical?
Screening just means to look at a whole population of people to try and identify a condition. So even the current screening that is done, which is a history form that's filled out and a physical that's done usually by the primary care physician, is part of a heart screening. But as I said, it's not very effective. So one thing that has been proposed recently is that every person, every athlete, every high school student perhaps, should get what is called an electrocardiogram. Typically, it's done for most people when somebody is suspecting a heart attack. So most adults who had chest pain, if they go to the emergency room, this is the test that they get. This EKG can detect most conditions if they are severe form of the condition.
Can these conditions get worse as a person ages? Or, maybe if they're an extreme athlete, if they're working really hard, can it get worse?
Yes. If you have an underlying condition like hypertrophic cardiomyopathy, There are other conditions. For instance, there is one which is called long QT syndrome. Then there are other forms of cardiomyopathy, such as what is called dilated cardiomyopathy, where the heart is extremely large and weak. And then very important condition, which the ECG cannot pick up, is a condition where you're born with an abnormality of the heart blood vessels that are supplying the heart with blood. In young people, if they are born with an abnormal coronary artery, whereby the coronary artery is coming from an abnormal location or is angulated abnormally, etc., they can be at risk of sudden cardiac death. You may recall, I think either last year or the year before, there was a young teenage athlete, I think from Central Catholic High School, who had an event while playing a game of football and was successfully resuscitated. It was in the news, in the Oregonian, etc. That young man was reported in the paper to have this kind of an abnormality. So this, for instance, is an abnormality that cannot be picked up by the electrocardiogram. So the electrocardiogram can pick up some conditions that pose a risk for sudden cardiac death, but not all of them.
So then what do you recommend for your patients?
Yeah, it is very hard to know what to recommend. There isn't one recommendation. The American Heart Association and American College of Cardiology have had a number of experts look into this problem, and they issued a report which came out a few years back. And currently, the United States recommendations do not recommend an electrocardiogram. There are a lot of people who feel it should be done. There are some studies from Italy, for instance, which suggest that in Italy, in their population, the ECG was very useful in identifying patients. That hasn't been shown yet in the United States population. There is also the problem of what are called the false positive electrocardiograms. So if you do an ECG, it may throw up other abnormalities, perhaps minor abnormalities, which may create a lot of anxiety, which may create further unnecessary testing. And the whole thing has to be factored in making a recommendation. So currently, the recommendation does not include an electrocardiogram.
Where can parents go to learn more about the pros and cons of screening? Is there a website you recommend?
Well, there isn't actually a website that talks about this in a very simple format. Probably the Mayo Clinic website would be a very useful one for them to look at. Other organizations that are very good at promoting the prevention of sudden death include one called SADS, or Sudden Arrhythmia Death Syndrome website. There is another website called CARE, C-A-R-E. These websites are useful. The definitive paper is in the Heart Journal.
Dr. Seshadri Balaji, a professor of pediatric cardiology at OHSU Dornbecker Children's Hospital. We're out of time, but thank you.
You're welcome. Thank you.